Papilledema is one of those things you really don't want to see in a test room. It's one of the rare cases where something actually is life or death. Let's make sure you know everything you need to. Papilledema is bilateral swelling of the disc due to raised intracranial hypertension. Now, what the cause is, it could be idiopathic, more commonly seen in obese women from 20 to 45, or it could be more sinister, something like a brain tumour or meningitis. Here are the red flags you really should be looking out for. The big one usually is headaches. They can be top of the head and can be quite intense. Usually the worst with posture, so it can be first thing in the morning when they're getting up out of bed, or sneezing, coughing, things like that. And sometimes, given the nature of the headaches, given they're quite intense, the patient can report nausea and even vomiting. The patient might have changes in the vision, so that could be things like greying, blacking out. They also might report changes in their hearing, which would be like a whooshing sound, and that's associated with tinnitus. They might even report some horizontal double vision, and that's when it's associated with a sixth nerve palsy. It's important to say not all patients do have symptoms, so here's what you should be looking out for on your fundoscopy. The obvious one is the swollen disc. Just make sure it's left and right eye. If it's unilateral, it's probably something else. The margins will start to blur, so instead of that clear margin where it goes from the red of the retina to the yellow of the disc, it will start to blur and cross over. They'll become quite indistinct. As the disc is pushed forward, the cup starts to disappear. It's quite hard to differentiate the disc from the cup. It'll become red and congested, and that's when you'll start to see the vessels become more tortuous. You'll see flame hemorrhages and cotton wool spots. Peyton's lines might start to develop, and these like little folds around the disc, and you'll start to lose your spontaneous venous pulsation. So that kind of pulse you can get with normal eyes, it won't have that. The signs do become more obvious as the papilledema progresses. So at the start, that swelling might be really subtle. As it gets longer, it becomes more obvious and it becomes more chronic. That's when it'll really start to become quite pale, and that's when vision loss is a real risk. Now, not all swelling is true papilledema. There is pseudo-papilledema. That's things like disc drusen, and that's when you want to use things like OCT to rule out true swelling. Now, if you do suspect papilledema, if you're sure it's papilledema, or even if you're unsure, it's a same-day referral. Ring up that hospital line. Make sure you get that patient in ASAP. And make sure you're stressing the importance to the patient that they do get seen. They're not messing around and putting it off till next week. But you do have to do it in a kind of cool, calm way. Make sure you're not overflooding the patient with information, but do stress the importance to them. It's one of those conditions where you really have to know your stuff. Make sure you're not umming and ahhing about it. It's one of those you kind of have to get right. And as I said, if you're unsure, play it safe. Save this video. It's everything you need to know. Any questions, drop them below.